As physicians, I think we would all agree that there is no room for politics in the physician patient relationship. And because of the politicization of many medical issues, providers are getting afraid to do what is part of our job and our responsibility, which is to correct medical misinformation. Let me back up and explain. Now, I learned very on in my career in medicine, the unwritten rule, the part of our culture that you don't talk religion or politics with patients. They're allowed to talk of it, and we hold space and we create space for it. But we don't talk about it because we want patients to be able to come as their self. We don't want them to feel judged. We don't want to create a divide because our politics and our faith do not have a role in our relationship with them. Their faith and their politics may have a role in their medical journey, but ours should not play a role. Now, having said that, there's no always and nevers. So I'm sure we all can think of examples where there are providers that did share politics and religion with patients. But in general, there's this kind of unwritten rule. And that's why when politics or faith come up, many providers feel a bit uncomfortable if it comes up in the examining room, in the office, in a hospital room, wherever, in an interaction with the patient. A lot of providers feel mildly uncomfortable because of this unwritten rule. We don't want to be asked about it. We don't want to talk about it because, like I said, it can affect our relationship with patients and our ability to take the best care of patients. However, due to the politicization of aspects of standard medical care, many physicians aren't speaking up when we can have the greatest impact on improving society's understanding of medicine. And we do it all the time already. When something isn't politicized, we do it. And even sometimes when it is, we all have experiences where people come in to the office and they talk about their best friend who told them never to take this medication because it creates something that you've never heard of, or they saw something on the internet. And part of our role is to help them understand, what do we know? What are the medical facts? And we share that with them. I'll give you a great example. A patient comes in and says, I heard the COVID vaccine decreases your lifespan by X number of years. Our response might sound something like, I have not seen any data to support that. What I have seen is, here's the data I have seen about the COVID vaccine. Here are the benefits. Here are the risks that we know of. And here's my recommendation and why. That's how we combat misinformation. We give them the facts that we know, what we don't know, and why our recommendations are what they are. This should be no different. When it comes to gender affirming care, it should not be any different that we have the ability to correct misinformation, whether that's for the benefit of the patient to make the best decisions for themselves, their families, or for society to understand how we keep each other healthy and how we want to support those standards of care. So let me give you some examples. An example of correcting medical information, not politics, but medical information, is when people say, well, I heard they're doing excuse me, that would not be the language. When people say, I heard they're doing sex change operations on children, something I've heard. Sex change operations on children. All you have to say is nobody's doing gender affirming surgery on children. Period. You don't have to go into more explanation. Just state the fact. That is the fact. Maybe they say something like, well, I heard they're just passing out hormones on a whim. All you have to do is decide one day that's what you want and you get it. You answer with medical facts. There is a multidisciplinary approach to the treatment of gender affirming care that does not allow for passing out a medication on a whim. It is a multidisciplinary approach with the decision made together with patient, family, and providers. And that might be even longer than you need to do. You could just say, nobody's doing that. Or even nobody at our institution has done that. Or that is not the standard of care of the way that it works. The third one is the comment that's often made: there's a high regret rate. You allow a child to transition, they're going to want to transition back. They're going to regret it. And there's data, even recent data as of October 21st, 2024, but there's some data even before that that all support about a 2 to 3% regret rate. And I'll talk about that newest study in next week's podcast. But the fact of the matter is the data supports that 97% of children who transition over long term are satisfied and do not retransition. Just stating the facts. This is how we state the facts to combat medical misinformation. And we need to combat medical misinformation for anything, because the greater understanding people have, then they can make the decisions that are best for them, especially when it comes to the voting booth. You're going to say, wait, hold on a second. Now you're getting political, Shannon. We said there's no room for politics. There's not politics between patient provider, but the facts allow people to understand what they're voting for. And the fact of the matter is, when our legislation affects our ability to provide the standard of care for patients, we no longer can maintain our Hippocratic oath of taking care of the patient to our best of our abilities. When we cannot provide the standard of care for patients, we no longer can provide the best service for every patient. And that goes against our own ethics, our own oaths, and our own promise to our patients. And this is why facts matter.